Hello, I am Dr. Caroline Eaton, and this week in medicine, I am talking about hair loss. Now, hair loss is something that affects about 50% of men and 25% of women by the time they reach age 50. Unfortunately, a lot of us are genetically doomed towards hair loss, and I am in that group. My mother has thin, fluffy hair. My paternal grandmother had thin, fluffy hair, and it is related to the X chromosome, which is from the female side. So if my mom has it, well, I know she's got two copies and only could have given me one, and my paternal grandmother had it, so the one that she gave my dad, who also had thinning hair before he passed away, was also going to be for hair thinning. And the hair loss is different in men and women. The patterns are. In men, you see that classic recession here and the bald spot at the crown of the head or the vertex of the head. And in women, what we see is this widening part. And you kind of get thinner and thinner at the top, kind of just diffusely, and that little middle part area starts getting wider and wider. Some women also have what's called frontal bossing as well, where you kind of get a little bit of recession along in here and a little bit to the temples. But it's much more common to have a general type of thinning. That's not to say there's absolutely nothing we can do about it. It's just you have to be aware of it and be willing to basically put some money into trying to maintain your hair. So how do we do it if you're the androgenic pattern of balding, which is what I just described? Well, the most common one we use is a medication called minoxidil, which is a topical medication of what originally had been a blood pressure medication. But topically applied to the scalp is helpful for reducing the loss of hairs, so we don't have as much of that, just the handfuls of loss in general, and it does help regrow some of the hair. Unfortunately, with the regrowth, sometimes it's not the same as the original hair from that follicle. It's more wiry, it's sometimes a little bit thicker, so it might help fill in the spots a bit around those areas where you have the longer hair or the different hair. But if you typically have a shorter style, it may be more noticeable that those hairs are different than your original hairs. With women, they typically use 2% Rogaine minoxidil, and men normally use a 5%. Women using the higher percentage has not really been shown to be terribly effective. Men have another option. They also have a medication called finasteride, whose trade name was Propecia, or is Propecia. And for that one, they really need to start taking the medication when they first start noticing the hair loss, and because it helps really more with reducing the loss more so than regrowing the hair that's already been lost. They'll regrow a little bit of the hairs that have been recently lost because those follicles are still healthy and active enough to start regrowing hair, but unfortunately it's not going to regrow a big bald spot. And so younger men who are noticing, men in their 20s and early 30s, starting to notice significant thinning and recession, may want to look at starting finasteride. One thing that's very important, women do not take finasteride. For one thing, it hasn't been shown to be helpful for women, and another, it can cause birth defects. We also recommend that the female partners of men taking this medication don't handle the pills because a small amount can get into the bloodstream and cause birth defects. So we want to make sure that women don't handle that. So it's something I said again, women are really, it's not effective for women, and it's also potentially dangerous for women to take. So that's off the table. Now, people have talked a lot about taking biotin for hair loss. And a few smaller studies indicated it may be beneficial. No larger studies have consistently confirmed that. And unfortunately, taking large amounts of biotin can interfere with certain lab tests. They can interfere with thyroid testing, it can interfere with hormonal testing, including estrogen and testosterone, and more importantly, it can interfere with cardiac testing. So if a person is taking biotin supplementation, especially higher doses, 500 milligrams, 1,000 milligrams, and they start having chest pain and go to the emergency room, the biotin can actually cause a false lowering of a screening test we'll do called troponin. And troponin is one of those cardiac enzyme tests that we do to see, okay, is this a heart attack or is this something else going on in the chest? And it can unfortunately cause a false negative on that test has happened in the past, and there's at least one documented case where a person died because they had a false negative on their troponin from taking biotin supplementation. Now, biotin itself really doesn't cause any problems. There's no toxic dose of it. And you really don't get deficient in biotin unless you have a genetic anomaly, because our bodies actually make some biotin. So it's one of those ones that you can take, but if you're going to be taking it, make sure you stop taking it at least 2 weeks prior to doing any blood work that will include thyroid or hormonal testing. And if you go to the emergency room, make sure you let the doctor be aware that you're taking biotin and that biotin can mess up the troponin test, because the doctor might not be aware of that. I was not aware of it until a couple of years ago. So it is that, make sure they're aware. Other things that can cause hair loss, one is stress. And when stress causes hair loss, we actually call that telogen effluvium. Basically means large amount of hair loss is what that translates to. And stress hormones will cause the body to go into certain other metabolic pathways, and hair growth is not really high on the body's priority, and hair loss can happen. And the unusual thing is people will have the stressful event at one point, but then not have the hair loss for about another 4 to 6 weeks later. And so you don't always recognize the stressful event with the loss of hair. So just being aware of that, oh yeah, it's under stress, and most of that hair will regrow. So that's the good news on that. And also taking, there's some herbals. This is actually one of those areas where herbals have actually been shown to be effective. At least all the double-blind testing has been done on stress. A herbal called ashwagandha, which is a very common Ayurvedic medication, and it has been shown to be very helpful at balancing out stressful events and stressful feelings without being overly sedating. So it's something, and typically the dose is between 100 and 300 milligrams twice a day. And so taking that, if you're under a stressful period, like actually now for a lot of people, may be beneficial at helping you reduce the stress without, and might help reduce that stress response hair loss. Now always talk to your doctor before starting anything, just to make sure it doesn't interact with any medications, because that's a very important thing. We don't want to be taking those. Not a lot of side effects with it, some gastrointestinal, and there have been some case reports of men developing man breasts with taking it. So always be aware of that there's always potential side effects to any herbal medication as well. And double check with your physician before starting it. And there's a couple of things medically that can cause hair loss. Very common in women. Sometimes women in their 20s will start experiencing hair loss, and that can be due to an iron deficiency. So if a younger woman is starting to have a lot of hair loss, double checking iron levels and for anemia. You can be iron deficient without being without becoming anemic. It could be in the low end of normal. So checking on that. Also, thyroid disorders commonly will cause some thinning of the hair. A lot of women will start noticing that in the outer part of the eyebrow when that occurs. Most people with thyroid disorders, there is a family history of thyroid disorders, but not always. Sometimes excess vitamin A can cause hair loss. So if you're taking a higher dose ADEK supplementation, that vitamin A can actually cause a problem. So be aware of that. And high amounts of selenium. Some people who are taking thyroid support vitamins will be taking selenium because it's always been tried to be effective for that. But if you get too much selenium, that can actually cause hair loss. So being aware of that is important. And vitamin D deficiency, there have been several cases that can cause hair loss in and of itself, and it may also increase the risk of an autoimmune type of hair loss called alopecia areata. And again, different studies have shown different things with that, but there's some consistency that vitamin D deficiency can contribute to that type of hair loss. Alopecia areata, unlike the male pattern balding type, is more associated with like little circles of hair loss throughout the scalp, and sometimes the entire scalp can be lost. There's been some baldness, especially in younger people who get alopecia areata, but most of the time that hair will grow, but not always. And the last thing that can sometimes cause hair loss that I want to mention is ringworm. Ringworm is basically kind of like it sounds. Some people have gotten it on their arms and things. It's a fungal infection. It's not actually caused by a worm. It's actually a fungal infection that has a raised up edge to it. And so you'll, like with alopecia areata, you'll have like little discs of hair loss. But on alopecia areata, the edge is smooth. With this, it's actually raised up. So those are things that can be very helpful for knowing about for hair loss. And if you're with me and really trying to not lose any more volume than you have to over time, those are all things we can try. As I said, Rogaine might be helpful. Biotin, maybe. I've actually taken biotin, and it might help a little bit. And it's definitely, as I said, there's really no toxic dose to biotin if you want to try it. Just be aware of the issues with taking a supplementation routinely. Ashwagandha, definitely, if you're under a lot of stress, may be beneficial for reducing hair loss. It's kind of gotten to be the darling of the alternative medication groupings right now, especially also been shown to be helpful in general for women who are having a lot of moodiness during menopause. So that's something else that might be beneficial. As I said, just talk to your physician beforehand. So I was on hair loss. Next week, I'm going to talk about different medical studies, because we're always talking about scientific studies. You hear about them on the news, and different studies have different weights, meaning some are more important than others, and how the study was done is a very important part of how much weight and importance to give that study. And so I'm actually going to use a lot of the studies on the hydroxychloroquine as my examples, and that way we can kind of discuss why some people still feel that it's very effective and others are saying, but the studies are not showing that, or this one study did and the other study didn't. And so we're going to go through the different studies and why this is still occurring and why this is still a thing, so to speak. All right, until then time, have a wonderful week and keep safe, keep healthy, keep physically active, eat your fruits and veggies.